Hello, doctor, once again. Um, or even if you're not doctor, you're a yoga practitioner, welcome. So this video is about the steps which you should be taking to provide a good online consultation. So we have a CARES centric plan, which is patient centric, so that we want to see the patient has really got the value out of the whole experience. So, and then they would be really using those knowledge and the information they gained in some potentially creative way. They should be able to use the knowledge in so that to improve their lifestyle, their health, and their well-being. So how we should go about the 30 minute, if it is a 30 minute, so we have broken it down into about five separate segments. We call it as CARES plan. So the first 2 minute, initial 2 minutes is to confide, and so the confide has two stages. First is pre-appointment, so people should be able to just prepare themselves, just go through the notes of the patient, just understand what the problem, just in a broader sense, like where is he from, what is the time zone, what would be the weather like now, what would be the patient's age, not so much on the disease part of it yet. So it's more generic about the overall. So it will help you to create a better goodwill with the patient. The second important part in the confide part is to when the meeting is just starting. So they would be a bit confused, they would be very nervous, they would be doubtful, they would have a lot of questions in their mind. So it is to create that, give them that relax, make them relaxed in that. So when you initiate, the phone might be not so clear, or the communication, the patient has to get more comfortable. So don't get into consultation straight away. You can have icebreaker question, just in a way that how was your day been, or just that they something which they can very easily answer. And then by that you can see the mood of the person, the communication. Is it hard for you to understand the pace you should be speaking at? Try to understand like what they feel comfortable. If they are speaking in a way that it taking very long time, so you can also slow down. Sometimes they can't understand, or they are finding it hard. If they are speaking louder, they are also expecting us to speak a little bit louder. So those are the things which we call it as the patient greeting and comfort is the initial 2 to 3 minutes. So after that we go into the assessment. So the assessment is the clearing the expectation. You can have a statement or two saying that in this session we would be expecting the patient to you to understand this, or hopefully we will get to a lifestyle plan, or we will be able to discover some whatever you think can be achieved in that 30 minute. That kind of a goal parameter gives that comfort in that this is what I would be expecting, and I shouldn't be talking about my family members, or I would. So you can also ask them to be precise, concise, to be like, let's just solve or one problem at a time, because they might start talking about I have a throat pain, and then they start about knee pain and backache, and you'll get all lost up, mixed up. So if they can give a mention, but they don't want to, you don't want to take them into details of all of them together. So if it is too many problems, then you can handle one or two problems per session and book them a follow-up session. So creating a bit of a expectation is good, because it's very new for them. They don't know what they expect, what 30 minute is, and they might not have done online consultation before. You're not touching them, you're not undertaking their pulse, so they might already feel that gap. You're not physically present, there's accent problem. So once that comfort is built, then expectation, you are also being making sure you got the patient history, of what the problem is, and then you take some notes before you start commenting about Ayurveda or anything. It is just a sentence or two is okay, but don't go into too detail. It is better to take the current symptoms, concern, observation, all in the clinical notes first. So be a good listener, and then eventually you have a chance to talk, and then that would be very useful way of approaching it and to save time. And physical examination, because we are not the review part is the where we are talking about more detail, like we can ask them how frequently. All that review part comes in the CARES-R, and we can just by visually we can check their eyes, tongue, skin, and keep taking notes, more notes. So that might take another 5 to 7 minutes. So it is close to 15 minutes by now, or 10 to 15 minutes. And then you can go into discuss the recommendation you have. You can discuss your findings with the patients. Again, don't go too technical, too medical term. If it has a very clear cut and a very known, like pre-diabetic or something which is very known to most of the people, then it's okay. But if it is like lymphatic, some very complicated words, try avoid it, or you can explain in a simple way. Or if you see the patient very clever and very involved and wanted to know more, and then you can go into more details as per the time permit. So that is the educate part, the CARES-E, which we go into discussing and providing them the dietary and lifestyle recommendation. Then comes the educate also is to, if there's any medicine which is to be drop shipped to them, or so we can take care of that. But if it is available locally, they can get it, or if not, just when you make the pharmacy report, just those medicines, and we'll work with the patient to provide that source that. So in that case, we have to see, we have to tell both, make notes of the dosage, usage warnings and all, and also verbally tell them, so that make sure they understood that. So if they have, you have to once in a while, especially when you are speaking, ask them question like, did you understand? You have any questions? Is it possible for you to? Sometimes they might say yes, but they didn't really recollect. Would you be able to take it in the night time by 8 o'clock? Would you be home? So any question which can, then they can think more. So I generally travel, or I do this, or I might not be. Then they can tell you those problems also, and you can further discuss. And the final part is the schedule. So you can wind up the whole session. Just conclude with your final points, some recommendations, something which very importantly they should start or do or stop. So those kind of things. And then also take the book a follow-up meeting. Tell them to book a follow-up if they have to, or if you can do so, you can do that. And then also send them that they would be sent a feedback form, and they can rate. It would be good that we always collect we send them a review form to collect their feedback, and so that we can continuously improve. So this is the C.A.R.E.S plan, which is our online booking protocol, how we would like to follow. So if you have any doubts or anything, just call me, message me. I'm always here. So we are here together, and hopefully we build a beautiful business around us, which will be helpful to other people as well. Thank you once again. Thanks for your time.